So, welcome to our video series on understanding pharmacology. This video is going to go through the basics of pharmacology, and then we'll get into the weeds as we go along a little deeper. But for this video, we're going to actually just scratch the surface. If you want to talk about dosing forms, scratching the surface is one of those. So for this particular video, we're going to start by defining pharmacology. So what does pharmacology do? It's the study of how drugs interact with living systems. So their therapeutic effects, what diseases are we trying to treat? Their chemical and physical properties, such as their mechanism of action, their side effect profile, where they act in the body, and we'll get a lot more advanced as we go along in this particular regard. And last but not least, the toxicology of a drug. So at what dose does the drug become toxic to the body? Drugs can be derived from plants, animals, and minerals. We call those the natural sources of drugs. And we do this through the study of pharmacognosy. They don't really teach this in pharmacy school anymore. They lump it into a broader pharmacology style class, or they integrate it throughout the pharmacy program, but you very rarely hear this term anymore. If you have an older pharmacist who may have graduated pre-PharmD days, they would actually have had a elective course in pharmacognosy, and that is, how do we get drugs out of a natural source? The newest set of drugs, 13 of the 15 drugs approved by the FDA last year, were what we call biological drugs. These are drugs that actually change cell programming through a DNA change. Sometimes you'll see them as recombinant DNA. Insulins generally fall into this class as a whole bunch of rheumatoid arthritis drugs or immunosuppressant drugs. So you see these drugs becoming more prevalent, and one of the things that is interesting about this class of drugs is that they are DNA instructions that are attached to bacteria. So what happens is you get this into the body, the bacteria is absorbed by the immune system or your body's protective barriers, and then the DNA instruction goes along with it. We call these biopharmaceuticals as the newest class of drugs. So how do we get drugs? We can't get them all from a natural source. So the parent drug of any one given family usually has some type of natural origin, like a plant-based origin. Most frequently is the case digitalis, quinine, opium, lovastatin. Now, lovastatin might surprise you as a plant-based drug, but it actually comes from a specific type of red mushroom. Obviously, we chemically derive that in a lab now because we can't get enough of that mushroom to supply us with lovastatin on a regular basis. Plus, that level is so low in that mushroom that it would not have a therapeutic effect, so we would need a lot of it in order to make it work. But it's there. So that's how we found the statin class of drugs. We found lovastatin first. Valium or diazepam has a specific plant base in the valerian plant root, and that's how it actually got its name, Valium. Animal-based medications, generally speaking, we're going to talk about pig-based medications because if we're looking for something that is closest to humans in the animal world, it is pigs. So thyroid, desiccated porcine thyroid, is one of our oldest patented medications in the newest era of drugs. And you know it by the brand name Armour Thyroid. So the interesting part about that story is Armour Thyroid got its name because it was originally sold by the Armour Ham Company in Chicago as a medication that came about for thyroids. They would just grind up the thyroid, throw it in tablets, and it was a byproduct of the manufacturing process for pork. So you see thyroid, desiccated porcine thyroid, come from this. We get pepsin from pigs, digestive enzymes from pigs. Sometimes we get that from cows too. So we can get a variety of animals that can help us derive medications chemically. Then there's a laundry list of medications that are mineral based. I gave 3 examples here. A lot of your over-the-counter antacids, for example, silver nitrate, over-the-counter and prescription antiperspirants would be mineral-based. From the natural-based drug products, we get synthetic drugs. These are drugs derived from natural sources and chemically altered into a new drug molecule. Generally, they're equal in strength or stronger than their natural counterpart. Opium, for example, leads its way to morphine, oxycodone, codeine, hydromorphone, oxymorphone, oxycodone, fentanyl, carfentanil, which has popped up in the news lately. As part of the broader opioid crisis. But those are chemically derived drugs. Lovastatin has chemically derived alternatives like simvastatin or atorvastatin or rosuvastatin, and you start seeing those families develop. And we'll get into the families of drugs as we go along in this set of courses. The last bunch is the biologics, and we talk about the genetic code delivering their effect. Biologics, generally speaking, are going to deliver some type of cellular level effect as medications go. So how does a drug get approved? Well, we got to find one first. You can't make a drug if you don't know what it is. So we synthesize a drug. We test it on animals and review it, whether or not it actually has a medical purpose. If we determine that it actually could be therapeutically effective on human beings, they file an investigational new drug application with the FDA. It's called an IND. An investigational new drug application approved by the FDA means you can go through clinical trials, and they do that to nail down the dose, get a side effect profile, develop drug interactions, side effect profiles, what diseases they're going to get the drug indicated for, and that goes through 3 phases of clinical trials. Now, once they have enough clinical trials to prove that a drug is safe and efficacious and that its risks are outweighed by its benefits, meaning it's more beneficial than the side effect profile that it presents, a new drug application is submitted to the FDA. The FDA will then review it. Now, in the case of any controlled substance, so if there's a potential for abuse or diversion of the Drug Enforcement Administration will also have to weigh in. And you see this specifically in the medical marijuana debate. There's a couple of drug manufacturers that are itching and twitching to get a nebulized THC approved by the FDA, but they can't until the DEA reclassifies tetrahydrocannabis into a different schedule. And we'll talk about those schedules in just a moment. But a drug also gets three names. The first name you'll be very, very familiar with. It's the generic name. It's the official name of the drug. It's assigned by the U.S. Adopted Name Council and approved by the Food and Drug Administration. This is the reference we use in all of our pharmacy literature. So, the United States Pharmacopoeia and the National Formulary and all drug labels always carry the generic name of the drug. And now, even if it's only available in its trade name, if you ever look right underneath that trade name label, it will give you the generic name of the drug in parentheses. That generic name is usually followed by an abbreviation USP or NF. So thyroid USP means thyroid, and the monograph for it would be found in the United States Pharmacopoeia. Hydroxycobalamin NF is another example, and that means hydroxycobalamin, and if you want to find the monograph for it, you look in the National Formulary. Chemical names of drugs are determined by the chemical structure of the drug, and if you thought the generic name was hard enough to pronounce, the chemical name is even worse. And that is the chemical structure of the drug. That's the pretty little picture when you unfold the package insert that shows you all the H's and the N's and the O's and the OH's and the HO3's, and you'll see all of the chemical structure of the drug, how it's bound together. Finally is the trade name of the drug, and that's named by the national drug manufacturer, and it has a set of standards it has to follow by the Center for Drug Evaluation and Research, so that we avoid a lot of those look-alike, sound-alike situations where you have drugs like hydroxyzine and hydralazine, which sound a lot alike but could easily be confused with each other, even though they do vastly different things. Finally, we're going to talk about the 7 levels of control on when it comes to drugs being approved, and then we'll get into dosage forms. Generally speaking, the DEA has control over the first 5, Schedules 1 through 5. The FDA can weigh in on the other 2. And that's the Federal Legend and the over-the-counter designations. But Schedules 1 through 5 are the DEA's territory, and the DEA places those Schedules 1 through 5 based on whether or not they have an accepted medical use and what level of addiction that goes with it. The Federal Legend means there's a medical use, but you have to have a prescription to get it, meaning you have to see a doctor. They have to evaluate you as to whether or not that drug is appropriate therapy for you. Over-the-counter drugs can be purchased by anyone, anywhere, and anyone can carry them. But generally speaking, over-the-counter drugs are just widely available over-the-counter. Now, about the levels of control. There is a Federal Controlled Substances Act, and then every state has a version of its own. So watch out, because states can actually do very strange things when it comes to controlled substances that the federal government is less stringent about. For example, Kentucky recently put gabapentin in Schedule 4. In Michigan, where I practice, over-the-counter Imodium or loperamide is actually a Schedule 5 controlled substance. So in order for me to dispense it, I actually have to do it as an exempt narcotic in my state. So I have to track it as an exempt narcotic. We're the only state in the union that still actually regulates loperamide in that way. But each state can put their own they can adopt the federal version exactly as it sits, or they can put their own spin on it. And if you want wild, off-the-wall ones, the erectile dysfunction drugs, so Viagra, Levitra, and Cialis in the state of Indiana and Illinois are actually controlled substances. So here I am in Michigan going through my order, and in my controlled substances tote is my erectile dysfunction drug. So if I order a bottle of Viagra, I get it in a controlled substance tote. So each state can put their own spin on it, and depending on where your wholesaler is state-wise, they may actually place them in different containment units based on that. So if they serve a state where a drug is a controlled substance, you might see those changes. So let's talk about dosage forms. The first dosage form, the most common one that you will see, is a tablet. It's a powder-based product that is put under immense pressure to be packed into a tablet. Generally speaking, these dissolve pretty quick into the body. You can have an immediate release tablet, which will dissolve in the stomach and then immediately release into the body. You can have what's called a repeat action drug, and this is a combined immediate release, extended release tablet. So the tablet has two layers. One dissolves in the stomach, the other one dissolves in the intestine, and if you want primary examples of that, look at Mucinex as an example. Those are bi-layered tablets. Delayed release means that it's going to dissolve in the intestine. There's a chemical coating that actually blocks stomach acid. Extended release contains some type of matrix to allow the drug to dissolve over time. Generally speaking, you cannot crush these up because that will take an extended release product and make it an immediate release product. So they cannot be crushed or chewed, and that would actually end up creating a situation where you could have some drug toxicity. Chewable drugs are designed to be chewed and swallowed. That's pretty straightforward. Buccal and sublingual are designed to be placed underneath the tongue or in the buccal pouch. Coated tablets are designed so that they can be swallowed easily. There's some film on there that allows it to go down the esophagus a little easier. And the last group are turquoise and lozenges. Those are designed to be dissolved in the mouth. Capsules, generally speaking, can be made in the same manner as tablets. You won't get the dissolvable ones, you won't get the chewable ones, but generally speaking, most of the dosage forms of a tablet will also follow into the capsule realm. Now, capsules are generally made up of some type of gelatin, either porcine derived, so pig derived, or they are plant-based, usually with fiber. So hypermellose, which is plant cell walls, for want of a better term. There are two different types of capsules. There's a hard capsule, which you see in the background of this picture, meaning it's a hard gelatin capsule, which you can pack powder or beadlets inside of. Soft gels are liquid that is sealed inside of a capsule, and that capsule is kind of like fused around it, and that's a soft gel capsule. And if you want the liquid that's inside without having to take the capsule, you have to puncture them with a needle and squeeze that out, but you can't guarantee that you're going to get the whole dose if you go that route. Oral liquids work the fastest of all of the oral medications. They're generally easy to swallow, and they come in a few different versions. They can be a suspension, which drug particles are suspended in some type of thick liquid. The contents is usually settle. Over-the-counter antacids are primary examples of this, and you will see that they have to be shaken up quite vigorously to get everything back into suspension again. Solutions do not need to be shaken because the drug is completely dissolved within the solution and you're pretty sure that that is a homogeneous mixture. Syrups contain high levels of sugar, can take on the form of a solution or a suspension, so watch how it behaves because you may have to shake a few of those. Elixirs are alcohol based and generally speaking between 5 and 40% alcohol. Tinctures are alcohol based, between 17 and 80% alcohol. Emulsions are mixtures of water and oil, and they require an emulsifier to maintain stability. Shaking is also required in this case because the emulsifier can only hold that liquid together for a period of time. It's like salad dressing. If you want to picture salad dressing, you've seen an emulsion in an action, and you have to shake your salad dressing, especially your Italian salad dressing, in order to get it back into a homogeneous mixture so you get the right balance of flavors because you don't want separated salad dressing and get an oil slick instead of Italian dressing like you're expecting. Bases, generally speaking, are either water or oil or a combination of the two, or alcohol. Water shortens the shelf life of a drug, and it requires other chemical agents to make suspensions and solutions. So, water cannot hold on to a drug by itself. Oil will give you a longer shelf life. It's a little harder to flavor. Now, when you're talking about flavor for either one of those, you do have to have a drug or flavor agent that is either water soluble for water based suspensions or oil soluble for oil based suspensions. Alcohol will require a water based flavor agent too, but you will need a lot more of it. And this is alcohol is required to make elixirs and tinctures. Some of the drugs are going to require that. Topicals and transdermals are ointments, creams, gels, suppositories, and then there's a specific transdermal group. Ointments are oil or fat based. They're designed to protect and soften skin. If they have a medication in there, they're not going to really get absorbed very well. They're designed to sit on the skin and treat primarily at the skin level. Creams are designed to be absorbed by the skin. Now, you're not going to get full absorption transdermally, meaning you're not going to go through all the layers of the skin, but you will get through at least one. Vanishing creams have a high water content. We call those oil and water. The second ingredient is the higher concentration of the two. Cold cream has a higher oil content, so we call that water and oil. Gels generally are water-based topicals, and you will see gels. They're generally clear or ever so slightly opaque, and you'll know because when they hit the skin, they'll actually start to run on you because once they get up to body temperature, they melt. Suppositories are shaped fat-based solid dosage forms. These are designed to be put into some type of body orifice like the urethra, the vaginal area, or for rectal use. And they are shaped so that you can put those in those areas. The last group are transdermals, and these are drugs that have a penetrating agent and are contained either in a patch or a cream, and they are designed to be absorbed through all of the layers of skin, either immediately in the case of a cream or a period of 1 to 7 days. So there are a few controlled release medications, like you see the fentanyl transdermal patch on the right hand side, that is designed to work over a period of 3 days. Occasionally you get patients that only get a couple of days use out of it, but generally speaking 3 days for fentanyl on that. Nicotine patches are changed daily, so When you do put directions together, though, make sure you put the word remove the old patch first. Otherwise, patients apply multiple patches and then they get toxic doses of drugs. Parenteral doses are designed to be injected, and there are 6 different types of injections available. So you can do intermuscular. Intermuscular is going to be injected into the muscle itself. Intravenous, those are going to go directly into a vein. Subcutaneous, underneath the skin. Intra-articular, so you can put them directly into a joint. Hyaluronic acid, for example, is an example of that. Intradermal, injected into the dermal layer. That's generally allergy testing, or tuberculosis testing will be an intradermal injection. Intrathecal injections are the ones that you have to be the most conservative with. These are injected directly into the spinal column. So these drugs have got to be uber sterile, because if you do not inject them properly with the proper sterility, you can get meningitis very easily. The body's defense mechanisms have all been bypassed in an intrathecal injection. We had a case where a compounding pharmacy had intrathecal injections that were contaminated, and those contaminated drugs caused over almost 80 deaths, and I'm pretty sure that death toll is already up there, well over 80 now, and that occurred 4 years ago. Inhalants are the last class of drugs I'm going to talk about. Inhalants are aerosols, powders, or solutions. They can be one of those 3. The picture you have here is inhalers. They are designed to be a powder that is propelled into the mouth and inhaled with the assistance of breathing in. Each puff has to be inhaled in one breath. Powder works the same way. So the powder is usually in a capsule on the inside of the inhaler, and you click a device to break the capsule open and release the powder into a chamber. You put the inhaler up to your mouth and breathe in. That is a powder style inhaler. The last one is nebulized solution. Medication is put into solution. It's then put into a nebulizer cup, attached to an air compressor, and then the drug is then misted and inhaled over several breaths. Patients with severe asthma would get their asthma treatments this way because they may not be able to have enough lung capacity to use an aerosol or a powder, for example. The last thing I'm going to show you tonight is the injection styles. So this is the last little bit. You can see how intradermal is injected at a 15-degree angle using a really short needle. Generally speaking, that's about a half an inch needle, 30-31 gauge. Subcutaneous is much the same way. Generally speaking, about a half inch to a 5/8 inch needle. Can be as small as 3/16. And you're trying to just get underneath the dermis layer of skin and into the subcutaneous tissue. If you have a short enough needle, you can do it straight up and down at 90 degrees. Otherwise, 45-degree angle is also fairly common. Intramuscular, which is what you see on the far left there, is done with a 1 to 1.5 inch needle. And that is going all the way down to muscle tissue. Generally speaking, we're talking about drugs that are like depo-testosterone or depo-estradiol, and those drugs are injected right into the muscle so they can be released by the muscle over a period of time. Some of the pain medications are also injected this way for patients who suffer from migraines, where an oral medication would not be a good idea. idea. So that covers the basics of pharmacology. In our next lesson, we are going to get a little bit deeper into bioavailability and half-lives and pharmacokinetics. So I look forward to having you join us next time, and I hope you enjoy this series. Thank you.